In terms of our current treatment of patients with atrial fibrillation, we made a lot of progress. And I think the biggest progress has been made in patients who have what we call paroxysmal atrial fibrillation that comes and goes on its own. And so for those patients, they're really having the majority of their time in normal rhythm and just have these little bursts that may be a few hours to maybe a day or so that occur, but the rest of the time they're in normal rhythm. For those patients, we've had the highest success overall. I think there are a lot of limitations that we have currently, and like anything else, we try to have a workaround. There's always a way to try to compensate for our inabilities and deficiencies, but there are a number of areas that I would probably highlight, and one of those basic ones is our inability to really see the heart tissue. We really have a hard time telling whether the areas that we treat are treated adequately. So we call that lesion formation, assessment of lesion formation. Are we doing a good job? Often, all we can really rely on are signals that we can measure at that time and then wait to see how the patient does. It'd be a lot better to have an easier way to do that. Similarly, we have a hard time navigating around the room. It's really like we almost have our eyes closed and have to kind of feel around in the area to really get a better assessment. The imaging tools really don't allow us to get really, I think, the kind of imaging we otherwise would see that, say, a surgeon has when they have the heart open and they're treating it directly. So those are some of the limitations I think we have. As I mentioned, even the effectiveness of lesion formation is also another area that there's some limitations, particularly as the patient's we say disease process progresses. So patients that have had AFib, say, for 10 years is a harder person to treat typically than someone who's had it recently. And so for those patients, the lesion formation is particularly important to make sure we do a particularly good job in creating that. And I think that'll be some of the ways in which we can improve the success of the procedure. Workflow is very important. We started with using current technology at the time and then applying it. So in order to do that, that made it so that we had to create a fairly complex sequence of events in terms of doing that, whereas new technology that's designed specifically for atrial fibrillation really might have the ability to make it much more streamlined, deliver lesions more effectively and quickly, and then to be able to assess also very quickly. And so I think that really has the potential to streamline the overall time of the procedure, really what the patient has to undergo. I'd have a big wish list, of course. So I think we want to make it as least invasive as possible. I think that's the spectrum we're looking at. So is there a way to very minimally disturb what the patient's recovery is, what they have to undergo, all those things. I think we also want to assure them as much as possible that a single procedure will work. And so really effectiveness really has to rise, in my opinion, and that's our big goal of doing that. And again, it's going to be harder for people who've had AFib for a long period of time, but that also would be a terrific goal to say, well, you've been in atrial fibrillation for 10 years, but in one procedure we can take care of that. Your recovery is not going to be very substantial. And those are the kind of things we hope to achieve. It's a great thing to target not only what the patient needs, but the driver in terms of who is seeing the patient in terms of physicians, because they have a very specific kind of vantage point. And so some of those things are clearly success driven. You want to appeal to the ability of increasing the success. So physicians are very much attracted to that. If you come up with a procedure that says, well, I'm going to gain 15% efficiency and effectiveness, that's going to drive people in that way. Time is somewhat of an issue, and ease of use is somewhat of an issue too. I think certainly procedures that take a long time to learn, that are cumbersome, that are not intuitive, I think have a hard time making it through the learning curve process, et cetera.